Hi, I'm Dean Gomez. I'm an actor, and almost 2 years ago, exactly July 2020, I was looking for a dermatology clinic that would enhance my dark circles, that would treat it. So I searched Google for it, and lo and behold, I saw CSA Medical Aesthetics on the search results. There, I met Dr Contessa Salvador Alapag, and she recommended PDO threads. And I couldn't be happier with the results. Actually, we have a follow-up video on her YouTube channel after 2 months of the procedure. You can check it out. Last time that we had a consultation, she told me that she would augment my chin so that this part, the jawline, would contour by itself. So if this goes out, this goes back. Guys, don't forget to click the subscribe button and the notification bell to keep you updated.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up, and let's welcome back Dean Gomez. Hi, Dean. Yeah. So I think it's like about 2 years ago when we did your treatment on the under eye area. When you had that concern of having like dark circles or tired eyes, right? And you don't want to have the filler injection because your experience with the filler was you had that bulge under the eye. But when we did those under eye derma threads, so looking at you right now, we haven't done anything yet since then. So looking at Dean, yes, assessing the tissues under the eye, the skin layer, muscular layer, fat layer, as well as the orbital retaining ligament. So far, so good. So imagine the effect of our derma threads for the under eye, meaning to say more than a year up to 2 years. Or it might be more than 2 years pa eh. Kasi Dean is still young, okay? So I think the younger you start, the better eh. In terms of the effect, it's much longer. The duration of effect is longer. It's because since you're still young, you still have this good dermis fibroblast. You can still synthesize more of the collagen and the elastin. That's why the result, you still have that tightness, the firmness, and that lifted look. Okay. And I was assessing din a while ago the under eye region. Actually, we can still do a repeat of that treatment to kind of like maintain that very good skin tissue tightness and still stimulate collagen, elastin formation. Because over time, of course, aging is a physiologic process. It's a continuous process. He's so busy with his career, right?
Yeah.
And you have also puyat nights, sleepless nights because of your career.
Always.
Oh, yun. I think you were like, during the pandemic, still lockdown. They made you stay in that facility for how long?
Yes po, we're locked in all the time. Every time for 1 whole month, we need to stay in one hotel.
Okay.
With all the directors.
There you
the
go.
production. Then
Okay.
less sleep.
Less sleep.
Yes.
Yeah. Because you know, if you lack sleep, of course, the eye area is the one whereby you manifest that having sleepless nights. So you'll have your sunken under eye, you'll have your dark circles again because of the puyat or the lack of sleep. But with Dean right now, it's a good thing that we did the PDO threads like more than a year ago, almost 2 years ago, and still we're looking at Dean, good results. Okay, so yan po. Dean is already sharing with us the outcome of what we have done, the derma threads, or we call it PDO threads for dark circles. And we are so glad that we have treatments here that really give this very good result. And in terms of the duration, in meaning to say, it lasts like certain number of years also, right? So just a little bit of a touch up na lang. It's either, well, Dean doesn't want the filler. Although I was still sharing with Dean, the hyaluronic is still a substance that actually our skin will still need it because it attracts water and it's giving hydration to that skin tissues. Although if you use hyaluronic filler for the under eye, I always, what I do is just to minimize it, just a small amount, and we do not overcorrect when we inject dermal filler. So a little bit of filler, but we're still okay with the PDO threads.
Yes.
Okay, so for today, so we're assessing Dean's face right now. What I noticed with Dean's face is that the lower third of the face, there is something lacking, okay? Because in aesthetics, we have the so-called mathematical formula, the rule of proportions. And I was doing a measurement on the lower third, particularly on the chin area. Because we have this so-called rickets line, whereby we have this straight line from the tip of the nose, the lower lip, up to the chin. So what we notice is that you lack the anterior projection on the chin part. But checking on the jawline, the angle of the jaw, so far so good, right? And I think in front of the camera, it's significant that you have a smaller face, correct?
Definitely po.
Yeah. But with the chin projection, that's the one that I'm like, I noticed also when I was looking at the camera. I'm looking at your face. It's just like, just this part, just a minimal enhancement only. There you go. Minimal enhancement. Not doing something that's overdone or like too much, but it's just within that mathematical formula.
Yeah.
Right, Dean?
Excited for it.
Yeah. So, what kind of procedure, what kind of treatment, and what kind of product are we going to use for Dean? We'll show that to you when CSA Medical Aesthetics return. And we're back. So, we're doing the so-called chin enhancement for Dean. And when we do this kind of procedure, we have to identify surface landmarks. Okay, so for the chin region, for men, actually the ideal shape would be a square-shaped chin for men. Unlike for women, it's more of a tapered chin or narrower chin. Okay, so when we do it for males, what we have here for our landmarkings, we make a straight line from the corner of the mouth down to the mandible region, and same thing on the opposite side. So just as a vertical line there. And then when we identify parts of the chin, so lower lip beneath this, we have the so-called labio-mentalis crease, and then beneath that we have the so-called pogonion, and then inferior to that is the so-called nathion, and then at the lower part is the so-called menton. Okay, so these are anatomical markings. Okay, Dean? And then we also make a straight line from the center of the philtrum here, a straight line there. And the tip there is actually on the symphysis menti already. Why is it significant to know those parts? We have to identify that. So in terms of our injection points, we know where to place our product material. So when we have male clients, we want a shape of a chin, of course, squarish, right, Dean? So for men, we wanted it to somehow become a pronounced chin in a way that there's this tissue volume and also a right projection and a right vertical dimension. So in terms of the anterior projections, a while ago we've shown you that the rickets line, we follow tip of the nose, lower lip, and then the chin part. So we have to correct this gap here. Okay, so we have to fill that in. Okay, Dean? Now in terms of the vertical dimension, we follow the 1:2 ratio. So 1/3, 2/3. So for Din, although there's still like a deficiency, just a minimal deficiency in terms of the vertical dimension. Okay, Din? So we can still do a little bit of an elongation combined with anterior projection. So if I want to do that for men, we can fill in both sides of this vertical line or center line here. So I can fill in this right side here and the left side here. Okay? And actually for women, I do it differently. I only inject center here at the so-called pogonion and then also at the so-called menton there. Okay? Now for Din, I will just be using the needle method, and we want a procedure that it's just gonna be like less downtime, or as much as possible no downtime, because Din still has work next week, right?
Next week.
So we don't want any bruise there nor swelling there. So we want it to appear like just natural, and we want to do a treatment that we call lunchtime treatment only or coffee break treatment only. Okay. Yes. So this will be my injection point. So I'll be filling in this left side here and right side here. And then for the parts that we need to be very careful with or be very, very cautious with is the so-called vessels, blood vessels, and nerve that come out from the so-called mentalis foramen. Where is that? If you make an alignment from the mid-pupillary line, okay, so I'm just following my pencil here, and then usually it's like beneath the corner of the mouth, like 1 to 2 centimeter approximately, you have the so-called mentalis foramen there. That's why I mark it with letter X. So we have to be very careful with blood vessels and nerve here. Same thing on the other side. So usually you can like approximate it from the mid-pupillary line to the corner of the mouth, and like a 1 to 2 cm there, you have your mentalis foramen. So there are vessels and nerves that come out of this foramen. And also we want to be very careful also with the so-called facial artery that comes out from the antegonal notch, mandibular notch. It comes out like this, and it branches off to your labial artery, superior and inferior labial arteries. So we have to be very careful, avoid those significant structures there. And as doctors, injectors, we know that when we inject our filler accidentally in those vascular tissues, then some problems may occur. So that's why you should only go to your doctors, trained doctors, to do these kinds of treatments. Okay, so that's for our review of anatomy, surface landmarks, as well as the blood vessels that we have to be very careful with. And then we also mentioned in terms of the injection points. So from here to here, those are the injection points. And anatomical plane will be the supraperiosteal plane or the deepest plane. So technique, it's gonna be a bolus injection and a needle method. Okay, now what product are we going to use? So for Din, we'll be giving him a so-called hyaluronic dermal filler, and I will be using my Voluma from Juvederm, and this is US FDA approved. Okay, so it's one of the best brands all over the world. So we've been using Juvederm for quite a very long time already, and this is Voluma from Vicross Technology. Okay, so we can use 1 syringe of our Voluma for Din. So right now we'll just clean the area again and change my gloves. A while ago we already applied topical numbing cream. We left it for about like 30 minutes to 45 minutes to numb the skin area. And the good thing with our Juvederm Voluma, it has a lidocaine, so that it will also help in, preventing any discomfort there. Okay, so we'll clean the area, and a while ago we had the numbing cream. So I'll follow my injection points. Okay, so I now have my 1 syringe of my Voluma Juvederm here, And what I like about this product is that they were able to improve the syringe also. Like this part here, like the injector, when they hold it, there's like a comfort in holding this kind of product. And then I have a needle here, a small one. And what I will be doing is I'll just direct, so first at the right side, and I'll pinch this part here and the needle onto the bony layer. Okay, I'm just gonna be doing this pinching like to be able to help Dean, for example, not really feeling the needle prick there. And in my practice, I still do aspirate just to make sure I'm not in a blood vessel. And then after 8 seconds, we can push about 0.4 to 0.5 ml of our hyaluronic Voluma Juvederm. And in injecting a filler, it's significant that you do a slow injection, low pressure, so do not be in a hurry. So we can just be very slow in injecting it for safety reasons. You're okay, Dean? Okay, there you go. So it has a lidocaine, so that will help also in numbing the chin area. Okay, so I'm already in my 0.7 there, so I'll make it 0.4. I'll be leaving about 0.1 to 0.2 just for balancing. So that's the right part there. Now for the left side there, so following again the center from the philtrum, and then I can fill in the left part of the chin there. I'm just gonna be doing this gradual pinching like, and then aspirate. Well, studies are saying that it's not really that necessary to do your aspiration, although for me I just do it just for the reason that I wanted to be sure I'm not in a blood vessel, although I know I'm in the bony layer, so it's the safest zone or layer to inject your filler. So I'll be using a 0.4 for this part here. And then after a while, we'll be doing an assessment, the so-called checking on the balance or symmetry, left and right side. And there you go. So every after doing your dermal filler, you can do your so-called massaging of the area. What's the feeling then?
A little full, but
Yeah,
no pain at all.
right. It's, yeah, I was about to say that you'll feel like there's some kind of pressure or heaviness, or you said that it's like the sensation is like it's full, right?
Yeah.
So there you go. Now I still have a 0.2 ml in my syringe, but I want to check now on my rickets line if I still need to add a little bit more, checking on the so-called rickets line. And as you can see, there's already a noticeable improvement in the rickets line. So tip of the nose, lower lip, and the chin, so it's already in that straight line. Okay, so for now, what I'm gonna do with my remaining 0.2 is, a while ago I've mentioned that I just wanted to have a little bit of like a vertical dimension improvement. Okay, what I can do with that is I can just direct my needle onto the symphysis menti or the menton region there. Okay. Cotton with alcohol again, please. So just want to be sure. There you go. And just directing it at the symphysis menti onto the bone. Actually, it's already the bony layer, so meaning to say we really need to improve it a bit. And the good thing with this product, we know that hyaluronic attracts water. It's a water humectant substance, so over time it will still absorb water, so you'll still notice some improvement. So it will still kind of like expand, or like there will be more volumization of the chin area. So I'm just slow in my injection in pushing the product, and I am almost done. Then we pull out. There you go. So we've done a simple technique of chin enhancement. We'll show the result when CSA Medical Aesthetics return. Back, so we'll now show the result to Dean Gomez. Is our mirror. Dean,
okay.
There you go.
Seen it yet?
Yeah.
Oh.
Yan. Right?
Wow.
No bruise, and there's an instant result. It's natural. It is still Dean, and we have used 1 syringe of the Juvederm Voluma.
Yeah. Thank you, Doc. It's really impressive. Kasi diba, I remember you mentioned this augmentation when I was smiling.
Yeah.
Now, even if I'm not smiling, still augmented.
Exactly, right? So there's already a balance with that of the upper and the lower part of this lower third of the face. The so-called 1:2 ratio. Plus, yes, you can touch it. Right, yeah. So the rickets line also, we checked it and it's already aligned, and so far so good. No bruising, no like sign that you had an injection there, but it's just that you can see already an improvement in the chin shape, the chin projection, the chin vertical dimension, and it's so natural. Kasi within, if you're in front of the camera, diba, it's also significant that you have this smaller face, narrower face. When you also like lengthen a bit your chin, it helps in, or it gives like an illusion that your face is narrower too. And also it's prevention of aging. For some of my patients with like severe marionette line, we also include the chin projection, chin augmentation in correcting already the marionette line. So it's also like part of the anti-aging regimen or prevention of the aging. Any message to our televiewers, Dean?
Yeah, you can message me about this procedure if you have any questions on my social media accounts, on Facebook and on Instagram, and also on Twitter. Just search for my name, Dean Gomez, DENEGOMEZ.
Correct.
I will willingly answer all your questions.
Or share your experience.
From the PDO threads to this augmentation. Ay, may baba na ako.
Yeah, there you go.
It has a shape already.
Yeah. And of course, it's very significant to do procedures na the one doing it is really well trained, certified aesthetic physician, a certified injector for fillers, dermal fillers. Because we give lectures, trainings for these kinds of procedures, and we really do detailed study of our anatomy, the injection techniques, the science or chemistry of the products that we are using, and make sure that they're FDA approved. Okay, Din? Oh, kasi I've heard that there are already fillers na they buy on the internet, and there were reports that there are fake or imitations of these kinds of, even the Juvederm. There were reports na there were imitations. So if you like look on the online, actually these kinds of products, manufacturers don't sell really on the online. They just sell directly to doctors. Just make sure that when you get products like this, they really are FDA approved and of course legitimate products. Okay. Yeah. Thank you so much, Dean, for sharing your time with us. We know you're very busy.
Yeah, okay. You as well. Good thing our schedule matched.
Yeah. Thank you, okay. And our televiewers are really glad that you've shared your experience with us. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. For those who have missed the video of Sir Dean here, you can watch that at our YouTube channel, Contessa Salvador. And please click the subscribe button, like, and notification bell. So thank you so much. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.